measure all of these parameters, not just by looking at someone's lab work. That's the key in the first step. But we follow questionnaires every single visit. I have questionnaires on people going back years, and I look and say, when we started 3 years ago, you said this was severe: energy loss, libido, sleep quality, inflammation, joint pain. And so all of those factors change dramatically with proper hormone balancing, with proper diet, exercise, good nutrition, doing IV vitamin therapy, EBO2, blood purification, and ozone therapy. Really, all of the different regenerative therapies and treatments we do, in addition to the core, which is natural bioidentical hormone replacement, affects people's vitality, your thought processes, mood, cognition. There's just no question. It is measurable and it's real. And it is, as I said before, one of the most rewarding things that we do for clients is just help improve the quality of their life and their family relationships. It really is an exciting field, an exciting time to be working with people to help them regain what they thought was gone. And so how do we make someone feel 10 or 20 years later? We restore their hormones to the same optimal levels they had when they were in their 20s. And that's, how many people are sick in their 20s? Pretty much nobody. You feel great. You take everything for granted. I don't remember how it was, but you know what? I didn't complain about anything. My shoulder didn't hurt, and I didn't have trouble getting out of bed in the morning. It didn't matter. We're out with your buddies till 3 or 4 o'clock. You got up at 7 and went to work. Somehow, I don't know, stupidity maybe, but we did those things. And so, we were bulletproof, so to speak, because everything operated from a machinery standpoint, biochemically, to near perfection. And then age came along and hormone levels changed. We started putting more toxic compounds in our bodies and the foods that we thought were healthy that aren't healthy. And so, it's another long topic and story is what is safe to eat and what isn't. So, obviously organic, fresh grown, not something that's going to last in the counter or the shelf for 6 months. Those are the things that you want to avoid, and staying away from anything refined, white, sugars, grains, those, what we thought was really the right composition of the food pyramid, really should be upside down, with meat and fats at the top and carbs at the bottom. The first step we do is take an extensive history and find out what they're doing and identify what's good and what's bad. Obviously, look at all the hormone levels, and not everyone needs a lot. I treat a lot of younger men and women, particularly men. I don't start them on testosterone just because it's low. If they're 30 or 40, I'm going to give them something to stimulate testosterone production. I think it's actually criminal to put a young man on testosterone, because now he'll never make more and he's stuck taking it for the rest of his life, or as long as he wants to feel good. So I use clomiphene, N-clomiphene, HCG, human chorionic gonadotropin, things that stimulate testosterone production. But that, again, is the key. Lifestyle, diet, exercise, micronutrient testing, vitamin levels, and then hormone levels. So just click on the link at the bottom of the page. We'll set up a telemedicine visit, get some labs done wherever you live, LabCorp, Quest, or whoever's close by, and then find a time to talk. So aspen-regenerativemedicine.com. We would love to try and help you.